Welcome back to I Got You podcast. This is a space where we have real, honest, and sometimes very uncomfortable conversation. The kind people are living through but not always talking about. Today we're talking about something that affects so many relationships, which is intimacy, is desire, and also what happens when that connection starts to just shift a little bit. Because I think a lot of people are sitting at home beside somebody they love, but they're quietly fighting something and the change that's happening in their body, and they feel a little disconnected. So today I am joined by Georgia Skyer. She's an RN. She's a sexuality coach, and so we're going to dive a little bit deeper into what happens and what we could do to change some of the things. So let's get into it. Welcome, Georgia.
Hey, hi.
Hey, can you tell me
Glad
a
to
little
be
bit?
here.
Yes, ma'am. Thank you. Can you tell me a little bit more about yourself? I know I just did a little bit, but you want to go a little bit more in depth about yourself.
Of course. So I work with women, mostly women. I do work with some men, but I predominantly work with women who are experiencing challenges anywhere on the sexuality scale. So women who are having trouble with painful intercourse, painful sex, any desire issues, any arousal issues, issues with orgasm, issues with connection. I have difficulty connecting with my partner, issues with just the overall intimacy itself, communication, struggles communicating sexual needs, discomforts, just communicating in a sexual capacity. I am a registered nurse and I've been one of those for over 30 years. And
Okay.
yeah, my profession took a pivot in this direction to support women in sexuality. I was a women's health nurse for a very long time, and I was able to see the gaps in sexuality where women are concerned. The women spoke up enough, I heard enough, I listened enough, and I got an understanding of where women are suffering, the area of their lives. Our society has gotten to a place where mental health is now recognized and we're taking that seriously. Sexual
Mhm.
health continues to suffer though. So I decided that this is a space that I need to position myself to help bring out women, especially in this capacity. And so here I am.
Oh, welcome again, and thank you so much for being on. Honestly, you already know, George, I have so many questions, but I know we're not going to try to put everything in this one episode.
We'll do our best.
Why does sex drive change in long-term relationships, and are most people misunderstanding what's really going on?
Okay. So sex changes in sex drive is very common in long-term relationships. And that is actually one of the major reasons why couples seek therapy the most and counseling for the change in the sex drive. Either one partner becomes where nothing's going on and the other partner is feeling that, or there are times when both partners are just on the low side of sex in the relationship. They're assuming that something's wrong with the relationship, but this, if you consider being with one person for a very long time, there comes a point where biology will come to the surface, right? So biology is just catching up. So my body is feeling differently hormonally, physically. There may be more pain in my body, in my partner's body. Testosterone in men, people don't talk about that enough. We're never going to hear enough about low desire in men
That part.
because there's enormous shame around that. So we're not going to hear about it, but it happens, right? But then look at the hormone, just the mess of hormonal changes going on in women. So that impacts how we feel and what we want sexually. But that doesn't happen when we're 25 years old and doing everything the way we want it. It also doesn't really happen in your 30s, right?
Right.
And then the 40s come around and the hormones decide that we're going to play tricks on you.
Mhm.
Then my body's breaking down too in certain ways. Health factors become a part of it.
Right.
Medication, I'm on medication for various reasons, and meds do change. Some of the meds impact your desire as well.
Which ones did that I heard is the high blood pressure medicine and also diabetes also?
Blood pressure medicines, diabetes medicines, anxiety medicines, medicines for depression, cancer medicine.
Yeah, yeah, yeah.
So, yeah.
And I know you said the men not talking about it because women get shamed a lot for, like, the dryness, right? Their smells are changing. They have no desire. They're laying in bed, and that's why the men always say,
we're going outside to seek younger women or other women because they're not understanding what's going on with that woman at that time. So why do you think
Globally, this is an issue. When we say men don't understand what's going on, half the time the women don't understand what's going on either. Because let's be honest, how many here recently, as a society, we're talking about menopause and the changes that occur. Prior to that, there was no conversation about it. So a woman may notice the changes in in their bodies, but they don't have the language for it. They don't know. I'm trying to figure out what's going on with me, much less explaining it to you. And then I may also suffer some shame over it. And then you're coming at me with it. All kinds of different
yeah.
crises start to happen in the relationship because now you're attacking me for something that I don't even know what's going on with me. And I'm going to say this even before we get to any other topic in the discussions. When men say I had to step out and get a different get with someone else because my wife or my long-term partner wouldn't, that's a cop out. That is never acceptable because again, you have a choice to leave that person instead of disrespect your relationship. Because once you disrespect your relationship, it is extremely difficult to come back. And we'll talk later on, perhaps, about how trust now impacts how I respond to you sexually.
But you're right because a lot of women we didn't know. Our parents didn't know to tell
No.
us
Right. Right.
about this is what's going to happen with your body because
Right.
again, is it shame? And then now social media. You see social media and they men bashing women. Other women are bashing women. Well, I got the WAP, but I got this. I have no problems with this, or something must be wrong with you. And so you see that a lot, and women are ashamed to even come out and talk about their sexual drive, their dryness, everything that goes on during hormonal shifts.
And we in the sexual wellness space, we are trying our hardest to combat that with more education and more information. Because the minute we see or hear of some foolishness about I have the WAP and all this nonsense, I want to ask you, how is it that do you think you're identically the same as every person out there? Right? You have red hair, I have brown, you have black, you have a mixture. We're all different. We have different eye colors. We have different, you're left-handed, I'm right-handed. We have so many things that are different about us. But yet, when it comes to these intimate things, we are all walking around thinking we should be the same.
We all
And
have
if
this.
it didn't happen to me, it shouldn't happen to you. And we need to stop it, especially women.
Yeah. I love that because you really don't hear people talk about that. I think we all think I got a vagina, so my vagina is going to be the same as yours. You're going, and I think that's the misunderstanding.
And we don't make sense as a human condition collectively. We make no sense when we say stuff like that because are all men penises the same size? Why are we running around looking for men with larger penises because the one we have stands like this? No, they vary. And just the same way men vary, we vary as well. And that is what I don't understand why we choose, because it's a choice, to not see that.
You think it's a choice or it's just lack of knowledge? Because do people think that all vaginas look alike? You know what I'm saying? Like, no education is put out, So is it like a knowledge?
Think some of it, a part of it. But we are still being traumatized by people out there who were educated, have the knowledge, and continue, because knowledge and core beliefs are different things. I still believe to my core that this is what it is, in spite of any evidence I might show you. Well, I don't care what you say. I know. These are the I know people.
Yeah.
So it's
And you know
education
what?
sometimes, many times it's not.
So what do you do then when one partner wants sex, right, and the other doesn't? What's really actually happening emotionally on both sides, and how do you fix it? Or how do you work through it?
So the biggest issue in relationships continue to be communication or lack thereof. And it's no one party to blame for this communication problem. It's either a partner who is too ashamed of what's going on or don't have words to say what's going on, and another partner acting emotionally or off of assumptions. So the assumption is this: you're rejecting me or you're avoiding intimacy with me because you don't like me, because this, because that. When these are, because how the brain works is it has to make up a reason for something when you don't have one.
Mm.
So I'm thinking, I know it's got to be this, it's got to be that, or it's that. Well, it's none of that. But you
Right.
would have to talk to me. You would have to ask me. And then on this side, I would have to have the words to explain it. I would have to understand it myself to
Mm.
explain it to you. Because frankly, a lot of times anxiety, my insides, I'm filled with anxiety because I'm recognizing that there's a change in me, but I
Mhm.
don't even have an explanation for it. I
Right.
don't know why. And so, do you see that right there?
Yeah.
You're accusing me of not liking you, wanting you. You're accusing me of this issue going on in our bedroom.
Mhm.
And here I am over here. I don't even know why.
You don't even know what's going on. So how I know sometimes we hear this, right? But how do you help your clients through that? Like what is I guess what are some of the words that you say to the man and also from the man to the woman to go through these issues?
Well, counselors, we start with the education piece, right? We help people understand the male body, the female body, the hormones, the changes. It's an education piece that starts from the beginning. We talk about the desire cycle. We talk about the arousal cycle. We talk about how hormones interfere with that. We talk about how life interferes with that, how medications interfere with that, and any and all things in between. And so once we put education on the table, we then try to decide what's going on in this particular relationship that's causing something on one side or the other. And typically, before we get halfway, the couple is able to pinpoint exactly what it is before we get too far in the
Oh,
session.
well, see, that's good then. I guess just
Yeah.
talking about it and having that
Yes.
patience to sit and listen.
I'll tell you this, overwhelmingly, especially from men, we hear, well, that makes sense. Oh, I didn't know that. Well, how come nobody? As an example, Heather, I recently I was on a different podcast. But this one was with men. It was a whole group of men in the room. And I was invited to talk about the midlife changes in women and how it might affect your relationship. And it really was the men wanting to understand how to better support their partners through this time. And I am telling you, it was only tears left to be seen in the room because the men were like,
Wow.
who was supposed to tell us this?
Wow. Wow.
So it was received very well. The men had so many questions, and then they wanted to know, could you come talk to my wife?
Wow.
Because I share with them, trust me, a lot of times your wife, she doesn't know.
Yeah.
She knows and she feels it, but
Mhm.
what is this? And imagine going through something or not even closing your eyes at night and not even being able to recognize what's going on in you and explain what's going on in you until someone
Embarrassed.
says, and
Right.
embarrassed.
Embarrassed. Yeah.
And there's some embarrassment too.
Yeah. Yeah.
So you want to take that woman and you want to say, okay, sister, let's talk. Here's what's going on at every
Right.
layer. And then it will make sense.
I love that, and I love that for the men who were willing to come to a conference or to a talk to talk about that. But what do you say to the other men that don't even have the patience because they're like, "Ain't nothing wrong with her," because you hear that a lot. Even before we used to see your period, they're faking all of this pain. There's nothing wrong with them. They could be stronger
My
than that. You
gosh.
hear that so
Yes.
often. Well, how do you talk to those men that are willing to say it's the woman? It's the woman that has
We We do our best, right? Again, we do our best to educate. We do our best to show evidence. We do our best to stimulate understanding. Then there comes a time, I always tell people, I'm probably not the counselor for you if you're not willing to hear the absolute truth. Because there comes a time when I say to women, is this the partner for you? And let's remove all the blinds. Let's remove all the shades. Is this the partner for you? Tell me, girl, lady, woman, what is it that you're looking for in a partner? What is the ideal partner sound like to you?
Mhm.
And as you tell me those things, okay, now let's look at your partner. Do they have that?
Yeah.
Do you have a person who is providing an environment for you to feel safe emotionally? Because I'm over and over, I have to teach women about safety, not in the sense of physical, because the first thing a woman wants to say to me is, well, he doesn't hit me. But does he provide a space for you where he's understanding, he's listening, he's making himself available, he's not judging you, he's not shaming you?
Yeah.
And you probably, I should wait to tell you why she's not having sex with you,
Right.
even
Right.
though you're not hitting her. Because again, our society consistently, over and over, we say, "No, he's not abusing me physically." We don't get there.
They're not
When I
emotional.
say, "Are you safe?"
They think physical instead of an emotional.
It shows in the body.
Yeah. Yeah. Is it ever healthy though to have sex when you're not in the mood for the sake of your partner? Or does that really slowly damage the relationship?
Two things. Yes and no. And I know it's like, what? Okay.
Yeah, yeah, yeah.
There's a difference in just that question. Is it safe to should we be having sex when you don't really want to? I have to break this down into spontaneous desire versus responsive desire just to answer one part of it. Spontaneous desire is what Hollywood teaches us. You see your partner, you want to jump in their skin and it's on and popping. And every time you say, "Come on, baby, let's go," we're going. That's what we learn, right? Porn tells us that the minute the clothes come off, everything is on. The reality, though, is that is not the way sex shows up in most relationships. And also, depending on where you are in your relationship, it may have been that way in the beginning, but when life and reality sets in, responsive desire is what takes precedence. So, meaning, I'm really not in the mood right now. I'm probably focused on a report that Heather asked me to prepare and not be late with it tomorrow. And then I have a bunch of other things on my mind. And here comes my partner, and he's rubbing me and touching me and wanting stuff. Am I in the mood?
Right.
No, but I value my relationship and I value connection with my partner. And I do want to be close to him or her. I want the closeness. I want the connection. And maybe when some of that rubbing is going on, some of those nice words are coming in, maybe when the feet rubbing is going on, then I may get the desire piece of it. And even then, even if desire doesn't come, but I'm enjoying the connection, strengthening our relationship. Totally different than me saying, "Oh my God, no, I don't even want to do this. You know what? Fine. I'm just going to lay here. And while I'm laying here, all I'm thinking about in my head is, Jesus Christ, when is this going to be over? I really just want to go back to that report Heather asked me about." That part, that version breeds resentment.
Right, right, right. Do you think a lot of people don't understand that though? That and also I guess that's a part of intimacy, right? Like if
Right.
the man or the woman knows, they need to know what intimacy is, not just
Yes.
sex
Not
is.
just sex.
Yeah.
And how many times have we said, Heather, intimacy begins the day before and a couple of days before, a couple of nice compliments and conversations before, a couple of nice gestures before, a couple of rubbing my feet the other day before. It's not, "Baby, take your clothes off and let's go."
Right.
That's not how it works for women typically. Now, again, when I say these things, I always say, I'm ready for the people who go, "Well, that's how it happens for me." Well, honey, you're alone on that island, or there are 5 of you over there, just
Right.
5. Come
Right.
over on this island. We got friends who are
Right.
saying, "Rub me first. Be nice to me every day first. Compliment me first. Send me little love notes and texts at work first." 5,000 of us are over here saying that. 5 of you are over there saying, "No, baby, just look at me and I'm ready to hump you."
And that's what I was gonna ask. What is intimacy? Because a lot of people don't understand that. Because if the intimacy is sex, what you mean? Go take your clothes
No,
off, lay here,
no,
and they think
no.
intimacy is that. So what is intimacy?
Intimacy is those moments that we share together where both of our bodies are safe and at peace. And I'm enjoying and loving the touch of your skin. I love your smell. I want to just sit here and stroke your hair. Let's sit and cuddle and watch a movie together. Let's talk about the day we've had together. Let's learn something sitting here together. What is something about me that you don't know? Ask me anything. Let me ask you anything. Let's just get close. Let's touch without a mission. This touch has no mission. We're just, your skin is so soft. Oh my goodness. I love the smell of your hair. This intimacy. Let's get, or just your company of us sitting together holding hands watching TV. But a lot of couples don't have that. We're home together. You're over there in that room. I'm in this room. You're doing your thing. I'm doing my thing. I have 13 things on my brain. You have some on yours. But then it's 9 p.m. Let's go. Let's get in the bedroom. You're reaching over here, groping me and going, "Baby, let's I want some. That does nothing for most women.
It definitely does. It
So
definitely does it.
there
Yeah.
was no intimacy before. There was nothing, there was no prelude. There was no preheating the oven before we bake.
Right,
There
right,
was
right.
none of that. We are just jumping into, the act
Yeah.
now. And that's where a lot of the friction is happening. You get a couple to sit in front of me and the woman says, "Oh, he doesn't do anything for me." The man is like, "What do you mean? I work, I this, I buy that. Just the other day, I bought you a brand new this." That's not what we're talking about.
Right, right.
Yeah.
They're not understanding that. I think,
Yes.
again, a lot of men
Yes.
or people aren't told what intimacy is
Right.
because
And
another
that's why you always hear the thing of when there's infidelity, the person who would bring you flowers at work, the person who would send you little nice notes, that's that
yeah.
reeled you in.
Yeah, yeah. And even some people think, or again, man or woman, I don't want to differentiate, but we're just in an argument. And there's some people now, you get into an argument, and when it comes to sex, that's the way they make up from that. But then there's some people, we just finished arguing, and you think that's going to be the best way to get back in. And it's not for some women. Because once
Correct.
I'm not arguing, it's still in my head. You haven't even apologized for this. And now you want go lay down and get wet for me. And I'm like, that's not how it
Correct.
works.
Correct. And again, relationships are so different. And this is why again I'm never going to stop going back to communication and learning and knowing and understanding your partner and stop treating your partner like you did the other one because I'm a different person and that person liked flowers. I like gardenia. I mean roses. I like gardenias. Stop bringing me roses. I'm not her. Or
Ooh, well,
my
that's
my my
gotta go.
last I used to come home and rub my last person's neck, and that used to have her soften and melt. There's some trauma in my past life. Don't touch my neck. I don't want you to touch my neck. But see, that was never disclosed. We don't have that relationship where you know not to touch my neck. So
Right.
because I'm saying don't touch my neck, well, what's wrong with you? Every other woman I've had love when I rub their necks.
And now you're the you're the
Now
bean,
I'm now I'm
you're all of
the
that.
sore thumb.
Yeah.
So where was the communication? Where's the understanding? Where's the knowing of your partner? And I always say your partner is supposed to know all these things about you because you're a team. You're a team. And you don't have enough room on this platform to hear the things that partners share with me
Yes, I
that
do.
their partner don't know.
You gotta come back. You gotta
And
come
I'm
back.
like, "What? What do you mean you haven't shared that with them? How do they support you through that then?" And when that thing is showing up in your body and how you respond to them, how are you going to explain it? So the secrets that we keep, we think we're keeping secrets, but we're tucking things into our bodies that will show up somehow on the other end and will fracture the relationship.
Yeah. No, it will. It will. Because like I said, a lot of things, embarrassment or growing up, you were told not to say certain things, so you don't talk about sexual trauma that a lot of people had growing up. So now when you have that rough sex, I feel, not me per se, but the person feels like they're being raped. You
Correct.
get what I'm saying? But they're
No
not.
understanding, no context. There's absolutely no context because we never talked about it. I never dealt with it. I never addressed it. And I'd rather just shut down than deal with you and and this is what I'm also going to probably do. I'm going to leave this relationship because you're forcing me into places I'm not ready to go.
You're blaming it on the other person, but the person doesn't even know what they're going through.
Talking, right? We could cure a multitude of sins if we would just talk more.
Listen
And listen, talk, listen.
and
No,
understand.
I'll say shut up and listen and then talk, be clear, and then learn how to, just learn how to give flipping grace. Give
Right.
grace. Because this we're dealing with human beings on both sides who may have trauma.
Yeah. Yeah. You think are men and women wired differently when it comes to desire, especially, over time? Do you think we're wired the same?
No, we're different beings.
Yeah.
And but let's be careful though. You see the narrative that says men are always wanting sex and women never want sex or women gatekeep, women block sex. That's not true, right? It feels like it, right? Because men are the pursuers
Yeah.
And the society put us women in a position to make it look like we're receivers.
Yeah.
Okay? Again, like I said before, men have low desire too. They do. Their testosterone levels drop and they don't want it as much.
Mm.
And they don't want to talk about it as much. And then there's a certain bit of aggression and anger and shame that comes in when they recognize that it is happening in their bodies. Somehow they start to feel like less of a man, and they may and can become more aggressive in their relationships.
That part. So they do become more aggressive, right?
It's because I'm ashamed of this.
But then they're not saying it, they're blaming.
Or you have the ones who will withdraw. And something's going on with my husband, but I don't understand what it is. He all of a sudden. And
Is
guess
one
what he won't do? He will not go to the doctor to learn that he has erectile dysfunction
right, right.
because that is going to be a huge jolt to his manhood. So I'm not going to go. I won't look into it because there's nothing wrong.
They say, and I know you're not a man to speak on this, but how could they say there's
Can't
nothing
speak
wrong?
on it.
But how could they say nothing is wrong and their penis is not getting as hard? The drive for sex like they used to at 20, 30 is not there. And they're
It's
still
you. It's you. You're
and
not
they
attractive enough.
yeah.
You're not responding to me in the bedroom enough. Maybe if I go out and try to get a younger, prettier
I was gonna ask you this.
girl, it's
That's
going
what
to
we
work. All the things because it's not them. It's what's around them that's the problem.
that's the question I was gonna ask you because they all older men are saying they're going to younger women because older women are washed up and this and that. I'm like, but they're in their 50s, 60s having erectile dysfunction, going to these young girls.
I have one of the biggest spoiler alerts. I see, because like I was explaining that I do have some male clients who come to me because just a little bit of what we're talking about, going out to see a younger girl, a younger woman because of this. So here's the problem with erectile dysfunction in men. Well, a man will try to have sex and the penis doesn't work or it half works. I like the half worked ones or come fast too. But they also notice something in themselves that sometimes the women don't notice. If you stage a man's erection, say 10 out of 10, 10 being the hardest, firmest, when a man is real proud of his erection, a man can notice when his erection has moved from a 10 out of 10 and he thinks it's now about a 5 out of 10 because that's how I discuss it with them. How would you measure it? And they'll say, I'm really probably about a 5 out of 10. I'm getting it up, but it definitely doesn't pack the power that it used to. So it's still erectile dysfunction.
Right.
But the more they think about it is the worse it's going to get. And that's
Right.
for a different discussion because you don't think about digesting your food. Your body just does it. You
Yes.
eat, it digests, boom, it's done.
Right.
You provide the right conditions for erection, it'll happen.
Right.
Provide the right conditions. Thinking about erection or thinking about the outcome of the sexual activity is not the right conditions for an erection. So
Okay.
that's why the more they think about it, the more it won't happen.
Okay.
So let me get back to then if what they're saying is true, I'm going to go find me a younger woman. Then I wouldn't have male clients who are 20, sometimes even close to 30 years older than a woman, and they're still seeing me.
Yeah. Yeah.
Why?
Yeah.
Somehow this young woman's not fixing your problem.
Right. Right. But they think, is it just to blame older women that we're not doing something? Again,
It's to blame anything and anyone. Because again, earlier we discussed how, some of the things men say, believe, and think. This is one of them. That penis is supposed to work till they die.
yeah.
Because my manhood depends on the functionality of this penis. So if it's not working, my manhood is being questioned. If it's not working, I am not willing to come forward and even say it.
Somebody else.
I'm going to buy all the little things and drink it. I'm going to rub all the things on it. I'm going to do all those things, but not understanding that one, I may need to look at your medication. Are you on any meds that's
Yeah.
affecting this? When was the last time you had your testosterone levels done? Any and all those things matter. What is your stress life like? Are you overly stressed? More
Yeah.
so than usual. So a lot of these things men don't think affect them, but it does affect them as
Right.
well.
Right. So, what are male Kegels, and can they actually improve
Yes.
performance, control, and intimacy too?
So Kegels people often think is a woman's thing, right? You hear Kegels in women's world all day long. Men have a pelvic floor too.
Mm.
Men have a pelvic floor, and it keeps it keeps everything together, right? It keeps everything working. And from in my sexual world, pelvic floor, the strength of your pelvic floor has a lot to do with the orgasm you feel, right? Weak pelvic floor, weaker orgasms.
Mm.
So for men and their erection, they need a good pelvic floor as well. And
Okay.
so should they be doing pelvic floor exercises or seeing pelvic floor therapists? Yes. If there, if there's an issue, and what is exercise, right?
Yeah.
Keeping all of our muscles conditioned.
Right, right.
They do a good job working on these biceps or on leg day, but what are you doing for that other muscle?
Yeah, yeah. Huh. I never really think about Kegels and men, but
They have it. It's the pelvic floor is a muscle. It's a
yeah,
muscle, a huge muscle nonetheless, and it has
really.
a big job. So, yes, men need to focus on pelvic floor exercises as well.
Okay, and it could help with intimacy, like you just said. Yeah, didn't know because a lot of people, even with the prostate cancer, they were told to do pelvic floor therapy.
And remember that if you also remember that arousal too has a lot to do with blood flow. So anything we could do in our bodies to improve blood flow, especially to the genitals, will help with intimacy.
Can you think can desire truly be rebuilt once it fades away? Do you think? Can you think?
Desire is like anything else in a relationship. If you ignore it, it's going to go.
Yeah.
And so if a couple is truly committed to each other and want to spice things up, we have to be open. In this life, as human beings, we have to be open. I hate to tell you that I run these sessions with clients and we talk about, they know my terminology, vanilla sex. Honey, if it's all vanilla and it's been vanilla when we met 30 years ago or 25 years ago and it's still vanilla, I'm tired of vanilla.
Yeah, yeah, yeah.
Here's the thing, couples are not interested in trying some chocolate, trying some what do they have out there? Rocky Road, trying some pistachio, trying
Ice cream.
nobody
Oh
wants
my
to try anything else. We
Still
just
want
want
vanilla.
vanilla sex.
That gets boring after all.
Yes.
Yes, yes,
And
yeah.
then let's talk again about interest. I told you, couples, be careful in your relationship when you're over here doing this and they're over there doing that. And that's what you do every day. How are you learning each other daily? Intentionally. I want to always use the word intentionally. When are you cutting out a slice of time for your partner?
Yeah.
Babe, let's go on a walk. Let's go just, something interesting happened to me today. Let's talk about that.
Yeah.
It's learning, relearning your partner every day. We take especially long-term relationships, as you asked me about intimacy in long-term relationships. We take our long-term relationships for granted.
Yeah.
We know they're there and they're going to be there, so we don't work hard enough anymore.
Right, yeah.
And you say, well, when we met 25 years ago, you were pursuing.
Mm.
You were doing all the things. You were showing up with the flowers or whatever you were showing up with. You were doing those nicey cutesy little things. You stopped.
Yeah. Yeah.
And just the same way you stopped doing them, I stopped expecting them.
Relationship just gets boring.
Gets boring. So you do have to, you can't buy a pretty flower that's blossoming and blooming and set it in a corner and not water it and give it sunlight. And
Right.
that's what we do in long-term relationships. We take a pretty flower and we shove it in the corner, we turn the lights off, we water it every once in a while, and then we say, my plant's dying.
Right.
I think a lot of it has to do with the fact that both men and women, we think sex is a physical thing.
Yeah.
Yeah, the act is, but they don't understand the deep emotional work that goes on into desire, arousal, wanting to, first of all, for women, remember, we have to feel that, have that desire, arouse, lubricate, get ready. When you bash me, shame me, push me in an emotional corner, there's no lubrication going on and there's nothing in it for me. And so that is the crisis that sits in front of me on a consistent basis. I am having sex with my husband of 15 years, of 18 years, of 20 years, and it's not good and I don't like it and I don't want it. I really could just be done with it, but how am I going to do that and maintain my relationship? Then I have to drag it all the way back to, why don't you want it? Why is it not good? How long hasn't it been good? When did it start not being good?
Right.
Blah, blah, blah. And when I hear things like, yeah, we've been together 15 years and it's never been good. It's never about me. It's always about what he wants. Then you have to also look at our society at large, though, and the message that men receive, the message that women receive. And why did you accept that? And you're still here 15 years later and nothing was ever said about it because talk about it? You want me to?
Yeah.
And I say to women, I ask them, is your relationship safe enough where you could speak about not being satisfied?
Mm.
Or you're going to send that man blasting in a corner and have him just become the most volatile missile out there when you
Right.
say, I have not been enjoying it.
Oh.
And women won't say that either because some have tried. And it's come back to, well, that's you because my girl before you did.
They start comparing and putting them down. Okay.
Yes. So you see that it's all entangled like this. And
Yeah.
it's not a this or that reason why
Yeah.
this is a problem. It's multi-layered and it's not an easy fix. Always.
Right.
And we also know the messages that women receive. Shut up, don't say anything. You're not even supposed to be talking about that anyway.
Right. Right.
And it's only a certain kind of woman talk about these things. So
That's what it,
when you have that dynamic, we won't talk about it.
can you really still love someone deeply and still not want them sexually anymore?
Yeah, because sex doesn't always have anything to do with not loving the person. I love you, but my hormones are jacked up.
Yeah.
I love you, but here's the part that we don't address. Life is killing me. I've got these kids. I got this group that I'm a part of at church, and they got me doing all kinds of things for the upcoming banquet. I've got this pressure on my job. We've got a new boss, and they've got me doing all of this. And then I also have some issues with you who 3 months ago you did something, and I have it right here filed away. All of this
Yeah.
is going on in my little soup kitchen up here at the same time, and
Yeah.
I don't have room for it. So the signals in my brain, they're not firing to send anything down to my clitoris
Right.
to
Right.
be aroused. There's no firing going on because I am clouded up here. My sympathetic nervous system is just taking over, and it's my nervous system. I have no desire, but I love you to death.
Uh-huh.
But guess what? When I can't explain that, and when my partner does not understand that, it comes off as something personal.
Yeah.
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 People hear this, and I know they take it for granted. You've got to manage the stress and the load in your life if you want to see improvement in your sex. Now,
Sure.
when you tell people manage your stress, it means nothing to them.
We don't know how to, I think.
You don't
Sometimes,
know how to.
yeah, you
How
hear what
you say, honey, you may have to get off of the hospitality committee at church. Get off the hospitality committee. Does your kid need 3 after school activities? You have to help people also manage their lives and come back to what is important
Yeah.
because you're spread out in all these areas of life and you can't have sex with your partner.
Yeah.
So it's priority, right? Are you
Mhm.
going to prioritize your relationship? Because then I'm no longer little Johnny. You're only going to do soccer. That's it.
Yeah.
And we're only going to go out there 3 days a week. I'm taking some time from the hospitality committee
Yeah.
and I'm going to go reacquaint myself with my husband. At work, I won't be volunteering to do all these things. Y'all figure it out.
Yeah.
And I'm going to make a time with my partner and we're going to go to the movies once a week or what the heck ever we choose to do. We're going to do us. We're going
Right.
to put and pour into us.
Yeah. It's easier said than done because there's so many people out here that are people pleasers and they say the church needs me or my work needs me to do that. The people pleasers are sometimes the
Yeah.
yeah.
And then you see me, I do sex counseling. There are others who do mental health counseling to help people with people pleasing and the other areas of their lives that have them committed to things in their lives that are not a priority. And what should we be doing as adults? We should be identifying the things in our lives that are priority and setting boundaries for the other things that are not. It's not that you can't do things in life, but we have no boundaries. We want to give 100% to everything in our lives.
Everybody. Yes, that's true.
Uh-huh. And
That's
then
true.
your relationships suffer. And then
Yeah.
you get into a situation now where you're living in the house like roommates.
There's so many other questions that I want to ask because a lot of things start from childhood when it comes to sex as well that we're not addressing. We don't know how to address. Our parents probably told us to shut it up and don't talk about it.
And
Yeah, so it's just so much and so much deeper we could dig into this
again,
conversation.
because people think sex is one factor, physical, and that's it.
Yeah.
This is why we are right here today. We don't take into consideration the multi-layered effect on human sexuality. Everything affects your sexuality. All the messages that you've ever received, all the porn you've ever watched or not watched, all the things that the church tells you, then you got the people over here telling you, then what your mind is thinking versus what is reality, then the lack of communication, then the physical ailments, because I'm also sick. I got physical things going on, I got medical things going on.
Yeah. That's a lot.
And all of this come together has a say so in how
Yeah.
I show up in the bedroom.
Wow. That's a lot.
It
You should
is.
do mental and sexual counseling.
Some days we straddle the fence. Some days I'm like, okay, wait. That part's not sexual. That part is actually something emotional, something mental that you need to address, something psychological. That needs to be addressed separately because that's not a sexual thing. Yeah, that's not my thing. This is why I work with some great individuals or when it's not, that's not my part.
Yeah.
You have to go back there and go deal with that.
Yeah, yeah,
'Cause
yeah.
that's why you're showing up this way.
Okay.
Yeah.
Well, Georgia, thank you for everything, for your honesty and for just for
Course.
being so open and your
Yes.
insights. So thank you so
Yes, it's a
much.
pleasure.
Yes, and I hope you will come back on again. I have tons of questions.
And I believe thank you for your platform because I believe it is platforms like this. It's people like you putting information out there. It's people like you challenging the narrative. It's people like you saying, let's do a panel. Let's get the men on. Let's talk together in the same room. Let's try to understand one another and not fight or accuse one another. Because you have your running list over here as a man. I have mine over here as a woman. But do they ever come together in the same room? And do we
Yeah.
try to understand each other? So platforms like this, we need more of. We need more of these discussions. We need to talk more about sex because the shame and stigma around sex is what is creating a lot of this. No
Yes.
one's talking. So you know what's happening when no one's talking? Everyone's assuming.
Assuming, yes. That's true.
Where a lot of assumptions are thrown out there. So let's cut out the assumptions. Let's talk about it. Talk
Yeah.
about it so we can know about it.
Yeah. Yeah. Oh, I appreciate you so much.